So yeah, we'll probably get started now. So thanks everyone for tuning in to MUHI's online public lecture series. Today we're joined by Dr. Reshad Ahsan, who will be talking to us about COVID-19 in developing countries. So COVID-19 has been a big change for everyone in every way. So hopefully this webinar here today will help us to understand it a bit more in the context of developing countries. So I'll get Dr. Reshad to introduce himself. Thanks for joining us, by the way, today.
Yep, not a problem. Okay, thank you, Paul. Thank you for asking me to present. It's been a good opportunity for me to organize my thinking about this topic. As I'll talk about in a second, my area of research is a little bit different, but like everyone else, I've been following along, reading about this topic, and it's been nice to sort of synthesize everything and present it today. So as you can see on my title slide, I'm from the economics department at the University of Melbourne. And one of the things that's happened over the last few weeks during the pandemic is that we've had a lot of people pretending to be epidemiologists. So I've made a conscious effort today to try to make sure that I'm not one of those people. I'm going to be talking about the challenges faced by COVID-19 in developing countries. I'm going to talk a lot about the economic challenges in addition to just the health challenges. But this, as we know, is primarily a health and public health challenge. And when I talk about some of the health aspects, my objective is going to be to try to lay out some of the issues that developing countries face and not necessarily provide sort of expertise on the health side. So what I'm going to do today is try to make 3 points. The first is I'm going to talk about the unique challenges that developing countries face. Now, this virus has been a challenge to very wealthy countries. It's been, and we've seen the scenes from Italy, from the United States, from the United Kingdom, some of the wealthiest countries in the world. And for a while in Australia, this was getting quite scary. And we've been fortunate over the last few weeks to put some sort of control on the spread of the virus. But if you're a policymaker in the developing world, you're facing the exact same virus, you're facing the exact same health risk, but you're doing so with very comparatively less infrastructure, less finances, less sort of technical skills to deal with containing the virus. And so I'm going to try to highlight some of that in the beginning of my talk. And then I'll move on to talking about this health versus economy trade-off. Many of you may be familiar with this discussion in the context of Australia. It's gotten quite heated online, lots of opinion pieces written by various economists in particular. It's highlighting the economic trade-off. Some believe that the trade-off exists, some believe that it doesn't. If you follow along in Twitter, it's gotten quite ill-tempered. So what I'm going to do today is just highlight the pros and cons of social distancing and lockdowns. I'll start by talking about it in the context of Australia before making the point that this trade-off is a lot harsher in developing countries. And the reason why it's harsher is that in developing countries, you have a large number of people who live on the margins of extreme poverty. So asking them to stay at home for any extended period essentially means that they're going to have zero income for that entire period. And these are countries where the social welfare system is nowhere near as well established as in Australia. So you're asking people who rely on daily wages to stay at home, which creates a much more different trade-off than the one we had to consider in Australia. And then lastly, the point I'm going to make is that let's suppose by some miracle, almost all developing countries figure out a way to deal with, or figure out a way to contain the spread of the virus. The last point I'm going to make is even in that sort of happy scenario, developing countries face external economic shocks that's going to limit its ability to recover in the medium term. So what do I mean? And there are multiple ways this could happen. So if you're a garments factory in Cambodia and you see throughout the Western world, if the Western world's in a recession, no one's going to be buying garments. So we're not going to go to the stores to buy clothes, or at least we're going to buy a lot less. That's going to translate into shut factories in Cambodia, unemployment, etc. And that's a medium-term risk. Even if Cambodia has the spread of the virus under control. But the point I'm going to emphasize today in the end is the risk posed by reduction in remittances. One of the realities of the developing world is that there are a lot of migrants in Western countries working temporarily, and they send a lot of money back home, and their families back home rely a lot on that income. And so if you have prolonged recession in developed countries, that's going to translate to lower remittances in the developing world, and that's going to have medium to long-term implications there, even if the virus is under control in the developing world itself. Okay, so those are the three sort of main issues that I'm going to talk about. I'll start by essentially sharing some facts, which I think most of you will be familiar with, but it gives us a useful benchmark to start off from. So this is a chart that shows daily COVID-19 deaths in developing countries, or if you think about low and middle income countries, and they're from the Johns Hopkins University website, so they've been collecting a lot of the COVID-related data. So I've taken that data, restricted it to low and middle income countries, and I'm just showing you a daily plot. So there's two things I want you to take away from this figure. First, notice that the upward slope doesn't really start until late March. It's a very different experience than Italy. It's a very different experience even than the UK, US, Australia. In Australia, we had our first virus cases, or the growth started a lot earlier than late March. But in the majority of developing countries, they were exposed to the virus much later than developed ones. And so for a while, the challenges that developing countries face was not really part of the discussion because, up until, say, middle of March, there's been a very small number of cases there. But since then, as you can see in this diagram, you've seen that same kind of exponential growth that you've seen in the US, that you've seen in Italy, Spain, UK, etc. And on the last date of the data is May 14th, and on that day, there's been more than 50,000 deaths in low and middle income countries. Now, that's only a sixth of global deaths, but there's very little doubt in my mind that this number is hugely understated. Developing countries in general, among many other challenges, one of the challenges they face is collecting accurate data. So this 50,000 is definitely an undercount. There's likely to be many more deaths which have not been reported that's COVID related. Okay? But it's a late problem relative to rich countries, but it's been growing exponentially in the same way that we've seen elsewhere. The second point I want to make in this diagram is to highlight the fact that return migration is an important vector through which developing countries are exposed. Okay, so one of the reasons why developing countries were exposed much later is because if you think about migrant workers in Western countries, so think about migrant workers in Italy, they were from countries like India, Bangladesh, etc. They were in Italy. Italy suffered a spread of the virus. It took a couple of weeks until lockdown started to be put in place in those countries. And that's when you saw migrants returning back to their home countries. And I'm not claiming that that's the only vector through which the virus is spread to developing countries, but that's an important vector, and also explains why there was a bit of a delay in developing countries' exposure. So what I'm showing you in this figure is something that is from a paper that I've worked on with some colleagues, where we're trying to show to what extent return migration explains the spread of the virus in low and middle income countries. So on the horizontal axis, we have a measure of how many migrants a country has to COVID-intensive countries. So here, Mexico is on the high x-axis value, again, which is just confirming the fact that it has a lot of migrants to the US, which has been a country where COVID-19 has been quite rampant. Similarly, Morocco has a lot of migrants to Southern Europe, and for the same reason, it's towards the right side of the horizontal axis. And on the y-axis, what I have is the actual number of deaths due to COVID-19. And you see this positive correlation. And what this suggests is that migration links, or having migration links to COVID-exposed countries, has some predicted value in terms of how many COVID-19 deaths you're going to have as a country itself. Okay, so this idea of migration being an important vector through which the virus is spread to developing world. But as I mentioned in the introduction, the virus is a challenge to all countries, regardless of how poor or rich they are. But developing countries face a particularly difficult challenge. Even prior to the virus spreading to their countries, developing country health systems, on average, are extremely fragile. There are very few ICU beds per capita, so very few intensive care beds per capita, and there's a shortage of essential medical equipment. So there was a recent report that in sub-Saharan Africa, all countries in sub-Saharan Africa have a total of 2,000 ventilators. Just to put that into perspective, there was a day earlier in a few weeks ago where a single company in Queensland provided 3,000 ventilators to the Australian stockpile. So one company provided a number of ventilators that was more than all of sub-Saharan Africa combined. So that gives you a sense of how limited the medical resources are. So in Australia, one of the things that the government has told us from the beginning is we want to put in place social distancing to make sure our health systems are not overwhelmed. The reality in developing countries is the health systems are overwhelmed from day one. So that's not necessarily a criteria that they could use in terms of designing limits on lockdowns, etc. The other challenge developing countries face is that given the nature of living arrangements, there's much less scope for social distancing. So there's the home environments are typically much more crowded. So on average, you might have 2 to 3 people living in a room. So if one person is exposed, the entire family is going to be exposed. It's much harder for individuals to self-isolate within a home. And this problem is even worse in urban areas. Because in urban areas, particularly in most developing countries, the poor live in a very cramped environment, often in slums. So there was a report recently about cases of coronavirus in the biggest slum in Mumbai. And it was particularly alarming because it's like all urban slums, the population density is very high, lots of people living in very limited space. And so just a few infections can lead to a rapid growth thereafter. And lastly, the third challenge that developing countries face is that they don't have enough testing kits and therefore are not conducting enough tests. So on May 14, Australia conducted 41 times as many tests per capita as Bangladesh. Okay, and that gives you a sense of this difference in scale in terms of testing capacity. So not only do policymakers in the developing world face infrastructure limitations, but they're also, in a sense, trying to contain the virus in a blind fashion, in the sense that they don't have the data that would be useful to drive policy in a targeted way. So in a sense, there's a complete lack of evidence guiding what they can and cannot do because of the limitations of testing. Okay, so the picture is quite grim for developing countries. They face many challenges. They're being exposed to the virus. And then one of the things that they could do is sort of replicate policies implemented in Western countries. Okay, so now what I'm going to talk about next is to what extent that's really a sensible thing for them to do. And so I'm going to start by talking a little bit about the pros and cons of what Australia has done well, which is implemented widespread social distancing. And then I'm going to talk about why that may not be applicable in developing countries. So in Australia, we fairly early, at least relative to many other Western countries, fairly early moved into a lockdown, right? Countrywide, strict social distancing rules in place. New Zealand did much the same, in fact, even stricter than we did. And the overriding goal there was that lockdowns are essential because it allows us to slow the spread of the virus, i.e. flatten the curve, and protect our health systems. Okay. The other argument for a full-scale lockdown is that a more targeted approach is not feasible. So an alternative would have been to identify vulnerable members of society, those that are senior citizens or have pre-existing conditions, and only ask them to isolate and let everyone else live somewhat normally. That's not feasible because if you're a senior citizen, you live in a nursing home, you're going to be exposed to nursing home workers who, if they're going to be freely roaming around in society, may be carrying the virus. Okay, so a more limited lockdown was never going to work in that kind of circumstance. The other argument for a lockdown, which guided Australia's policy, was that if we let the virus spread in an uncontrolled fashion, we might end up with the situation that we saw in Italy, which we're now seeing in the UK and the US. And that on its own has economic effects. An economy where a large number of people are infected, people are afraid of being out and about in public, is never going to be a healthy economy. So you need to kind of fix the health situation first in order for the economy to be operating somewhat normally. So these were all the arguments for social distancing, for a lockdown in Australia. But there were some arguments against. And the two main ones was that a lockdown means effectively closing down of many businesses. And if it's not a full shutdown, at least a huge drop in business. This was attenuated somewhat by the fact that the government put in place very generous policies to provide employment subsidies, to give some income to individuals who would have otherwise been laid off, and various other forms of fiscal spending. But nonetheless, even with those, we do see businesses across the country suffer huge drops in revenue. And that's an important economic cost that we need to think about. And the other one is a health cost. Asking people to live in physical isolation for 4 or 5 weeks has both physical and mental health implications, and just negative income shocks in general has negative mental and physical health implications. So these are roughly the pros and cons of a lockdown in the context of Australia. In the case of Australia, we decided that the government decided that the arguments for a lockdown dominated, and so we went and implemented nationwide. Now let's think about all of this in the context of a poor country. All of the arguments for a lockdown that I laid out in the previous slide also applies to a poor country. It is true that if poor countries could implement a lockdown, they would protect their health system better. It would be better for the economy in the sense that you would have fewer people who are infected and diminish any sense of panic. But it doesn't mean that we can just copy and paste whatever policies we see in Australia and New Zealand and implement it across the developing world. And there's various reasons for that. In addition to the negative effects I highlighted in the previous slide, there's a few that are more developing country specific. The first of which is in a typical developing country, a majority of workers are in the informal sector. In South Asia, for instance, anywhere from 60 to 80% of workers work informally. Now think about how JobKeeper worked in Australia. You had money from the federal government go to registered companies, which were then funneled to workers. Right? So the registered companies was the sort of the in between the federal government and the worker. If you're in a developing country where 60 to 80% of workers are in informal business, that informal business by definition is not registered, and you don't have that mechanism for governments to directly transfer money to workers via firms. So administratively, it's a much harder thing to do to transfer cash in this way to workers. Now, the other argument against a lockdown that is developing country specific is this idea that populations are much younger. So in Bangladesh, using Bangladesh as an example, about 5% of the population is above 65, whereas in Italy, it's close to 23%. And so some have argued that that's a reason why countries like Bangladesh should be in favor of less stricter lockdowns. The counter argument being that if you look at the absolute number of over 65 individuals, there's more of them in Bangladesh than in Italy, simply because Bangladesh has more population. So it's true in the developing world, people are younger, there are fewer people who are above 65. But if you look at the absolute number of people above 65, there's a lot of them in the developing world. So this argument is perhaps not quite as strong. But probably the most important argument against a strict lockdown in developing countries is the risk of what's known as a hunger pandemic. And I'm going to use data from Bangladesh to sort of highlight these points, just because it's the country I know the best and the country where I have access to the data. But the points I'm going to make in this slide, I think, are broadly applicable across the developing world. So what is this hunger pandemic? Let's suppose we put in place strict social distancing and strict lockdowns, which some developing countries have done. What does that do? Well, these are economies where a greater share of the population rely on daily casual income. So think about a person who drives a rickshaw in some parts of Asia. If there are no customers who want to hire a rickshaw, that worker has no income for that day. Right? So when I say daily casual income earners, I mean workers who don't get paid unless they have work. Right? This is in contrast to me. I'm a salaried worker. If I didn't work yesterday, I can make it up today, tomorrow, etc. My monthly salary is not going to be impacted. But if you're a domestic worker, or if you're a rickshaw puller in South Asia, if you didn't work yesterday, you didn't get any money. And so for people like that who rely on daily casual income, a shutdown or a lockdown is going to be extraordinarily costly. And you're seeing this in Bangladesh. So immediately after Bangladesh put in place social distancing policies, there's almost an 80% drop in daily income for wage laborers. So these are casual workers. The other big factor that we need to keep in mind is that in the developing world, people have very limited savings, or a larger fraction of society have very limited savings and very little food buffers. So here in Bangladesh, from the same data source, we see that almost a third of the population has less than 3 days of food stock at home. So if you ask these people if their income is zero for multiple days, they're going to quickly run out of whatever food stock they have at home. And then more broadly, just going beyond Bangladesh, the World Food Program estimates that about 250 million people in low and middle income countries are at risk of starvation if there's prolonged lockdowns and social distancing in place throughout 2020. So this completely changes, in my opinion, the lockdown versus no lockdown trade-off that I talked about a couple of slides ago. In the Australian case, where the government can put in place programs such as JobKeeper and JobSeeker, you can take care of some of these negative implications for poverty. Developing country where governments either don't have the money or the administrative capacity to implement these types of social welfare programs, and where you have a large share of the population living on the margins of extreme poverty, a shutdown is likely to have catastrophic economic effects. And so again, ultimately, whether the benefits of lockdown outweigh the costs is a subjective decision. But the cost in terms of the foregone income in developing world is much harsher than anything we see on average in Australia. So what can be done? And here I'm going to step out of my area of expertise a little bit and summarize essentially some of the things that I've picked up over the last few weeks. Now, one of the things that's true is while this particular virus is new, we have had epidemics in the developing world before, right? So the one that comes to mind is Ebola in Africa. And there are lessons to be learned from how countries fought the Ebola epidemic and in translating that to policies for today. So I'm going to rely on this article by Khalili and Saltmarsh, which talks about an NGO in Uganda and what it did to try to combat the spread of Ebola there, and essentially take their recommendations and discuss it here. So one of the things they really emphasized was the importance of communication all the way down to the community level. And Vietnam is an example of a country that has done this really well. It's been much, compared to other developing countries, Vietnam has been much more aggressive in acting early and acting in a sort of organized manner in communicating to the population how serious the virus is and what they need to do in order to stop the spread. So this type of information provision is essential. Equally important is targeting misinformation. So again, speaking about Bangladesh, there's a huge degree of misinformation about what works and what doesn't. So people are taking antibiotics to fight the virus, even though there's no evidence whatsoever that it helps. And they're self-medicating other things that might actually be harmful. Okay, and it's all being driven by this sort of sense of panic due to misinformation. And misinformation also creates a lot of stigma. So in many parts of the developing world, families are very reluctant to admit that one of their members is showing symptoms of COVID-19. They're very reluctant when they go to the hospital to truthfully reveal symptoms. And in fact, many hospitals, particularly private hospitals, are refusing to treat or admit patients who are showing symptoms of COVID-19 because they're worried that their other patients might be scared away and they'll lose business. So there's stigma affecting both the individuals who have symptoms as well as health professionals, particularly in the private sector, who are behaving in ways that are not contributing to slowing down the spread of the virus. And the third point, which again, living in Australia, you kind of take it for granted, but this is something that's quite a huge issue in developing countries, which is access to basic things such as clean water and such. So in sub-Saharan Africa, according to a recent article I've read, the majority of the poorest people in these societies do not have consistent access to soap. And similarly, large numbers do not have consistent access to clean water. Now, these are things we take for granted in Australia, but in many parts of the developing world, these are, in a sense, these are necessities, but are not available in a widespread manner. And so here, there's a role for government to try to freely provide soap and access to as much water as it can, because we have households in the developing world, even if they're aware of the importance of hand hygiene, do not have the basic equipment necessary to actually follow through on that. And that's something, that's a sort of a gap that I think governments can fill in the short run. And the last point, which is more of related to the economics of this, as I mentioned earlier, that because of informal sector employment, there's less of an ability for governments to channel resources through firms to workers. And in general, because a lot of people in the developing world do not have bank accounts, sending money directly in that fashion is also not feasible. There are alternatives. One thing to do is to distribute food and other essentials directly in rural areas as well as low-income urban areas, and also leverage the presence of mobile money to transfer cash. So in many parts of the developing world, starting with Kenya, for instance, there's a lot of take-up of these mobile money platforms. This essentially is a way for you, if you have a mobile account, you can transfer money between to individuals just by using, all you need is a broker in between. And that provides an opportunity for governments to provide cash to low-income households, even bypassing the banking system altogether. Okay, but that's one potential way in which governments can respond to alleviate some of the economic stresses. The last point I want to make today, and there's a lot, is to talk about some of the medium to long-term economic challenges. Let's suppose developing countries in general, either through luck or through good policy, are able to largely contain the virus. Unfortunately, that doesn't guarantee it's going to be smooth sailing from an economic perspective in the medium to long run. And there's multiple reasons for this. Many developing countries rely on tourism. That's unlikely to be an active sector in the immediate future. A lot of developing countries are heavily reliant on exports. Countries like Vietnam, Cambodia, Bangladesh, India, etc., are large garments and textile exporters. So if people stop buying clothes in the Western world because of recessions, that's going to have these feedback effects of lowering demand in factories, and therefore lowering employment in these factories in the developing world. The other very important mechanism through which developing countries are likely to be impacted economically is remittances. So last year, $554 billion of US dollars of remittances were sent from the Western world to low and middle income countries. So these are migrants who live and work in the Western world, sending money back to their families. The dollar amount exceeds the total amount of foreign investment by Western countries in these two low and middle income countries. So these are huge numbers. The World Bank projects that this year there's likely to be a 20% fall in remittances. So we're talking about low to moderate income households in the developing world suffering a 20% fall in remittance income, not just for this month or next month, but in the medium term. And that's likely to have very severe implications for not just poverty, but the nutrition of children in these households. So typically when incomes go down, households in very poor areas tend to substitute nutritious food for basic staples, so carbohydrates, switch to a more carbohydrate heavy diet and away from nutrition, which can sometimes be expensive. And also it's likely to have negative implications for child labor as well, right? So these are all economic stresses that are coming from external countries. And here in this hypothetical scenario, even if the country has essentially contained COVID-19, they're still likely to suffer these adverse consequences. And it's not just a national level effect. So again, in some of the work we're doing, we're trying to identify parts of Bangladesh that are particularly exposed to adverse remittance shocks. So here, this is a sub-district level map of Bangladesh, where the darker the red is, the greater the percentage of migrants that have left that sub-district to go overseas, right? So, and it's generally the eastern part of the country. So it's not like the pain or the economic stress caused by lower remittance income is going to be spread evenly throughout the country. There are going to be isolated parts of the country that are especially adversely affected by reductions in remittance income. So these are going to be localized economic stresses in Bangladesh, and I think this is going to be true for across the developing world. Philippines is a country which is again very reliant on remittance income and is likely to have these localized income effects. Okay, so I'm going to stop there. Thanks for joining in today, and I'm happy to take questions now. You can either ask directly or through the chat box.
Awesome. Thank you so much, Dr. Reshad, for that. That was really insightful. So we've got a couple of questions in the chat now. So from RL, I'll just read the questions out, and you guys can just leave the questions in the chat, and I'll read them out for Dr. Reshad to answer. The first question is, pardon my ignorance and for asking such a general question, but what can be done to help developing countries, or is monetary donation the only way?
So I'm guessing it's what we can do living in the West to help?
Yeah, so I guess, so.
Yeah, so that's interesting because there's at an individual level, we're kind of restricted because we can't travel to developing world, and sort of, it's not like a natural disaster where we can send aid workers, etc., to parts of the developing world. Everyone's kind of stuck in their own country. But at a national level, even though we can send technical expertise in terms of aid workers and other technical people, there are a couple of things we can do. The uncontroversial one is to make sure that there are no export restrictions in place. So Australia has actually been very good at this. We haven't restricted the ability of our companies to sell medical equipment overseas, but others have. So France has put in limits, the United States has put in limits, and other countries have put in limits on the ability of their firms to sell medical equipment overseas. Now, this is a huge problem in the developing world because they're entirely reliant on imports for medical equipment. Most developing countries are not able to produce ventilators on their own, at least not at scale. And so being able to buy from overseas is their only way to access these imports. So from the developed world perspective, making sure we don't put in place these export restrictions is crucial. And I think for countries which, and the more controversial topic is, for countries such as Australia or New Zealand or any country like that, or Germany, for instance, which has a relatively better handle on the virus than others, sharing some of the stockpile that we built up over the last few weeks and last couple of months is a really important way in which we can help. So for instance, if we take 500 ventilators from our stockpile and share it with, say, Cambodia, sure, 500 ventilators is not a trivial reduction from Australia's stockpile and something we need to think about, but 500 ventilators in a country like Cambodia could have transformative effects. So that's another way in which at the national level, Western governments can help developing countries.
Cool. Thanks for that answer.
Yeah.
So I've got a question from Vithu. So what has been the impact of religion or religious figures on how governments have dealt with the pandemic in developing countries?
Yeah, that's also a really interesting angle. And I'll speak about, again, Bangladesh, which is where I'm from and which is the country I know best. It's been a mixed bag. So many of you may have seen an article recently about a religious figure dying in Bangladesh and thousands of people showing up to his funeral. No social distancing whatsoever. So that's an absolute crazy thing to do in the middle of a pandemic. But at the same time, religious figures, particularly in rural and isolated areas, are community leaders. And so I know some of my co-authors have projects where they're trying to spread information and they're using religious leaders as the conduit. So interviewing religious leaders, spreading information about hygiene and other practices, and relying on religious leaders to spread the word within their community. And so the role of religious figures in particular in developing countries is a complicated one. I think there's, to the extent that they're community leaders, I think they're an important partner in trying to halt the spread of COVID-19, particularly sharing information. But at the same time, we also don't want sort of large religious gatherings, and because that's going to be sort of a fertile ground for the spread of the virus.
Cool, that's a very, very interesting take on that. What I might do from now on actually is just, I'll get the people who asked the questions in the chat. So you guys can continue typing the questions in the chat and I'll unmute you. So Jessica Blaine has a question on how to, on specifically Vietnam. So I'm just gonna put you on, I'm gonna unmute you, Jessica, then you can ask the question. Yeah, so I'm clicking unmute, but it seems like you might not have a mic. Okay, I'll ask
I mean, I can see the question, so I can.
Cool. Yeah, so I'll just read the question out so that everyone else can hear it. So, hi, could you expand on Vietnam's case and how they better communicated to citizens to curb stigma and panic?
So, one of the things that's important to keep in mind is that a lot of knowledge is being created in real time, and ultimately it's going to take a while before we really figure out what Vietnam did that worked and what some other countries that didn't work. But in terms of what's being acknowledged in Vietnam is early preparedness. So they took this seriously early, and that's in my casual sense is highly correlated with how successful a country or a region is. There's a story about the Indian state of Kerala where the state health minister also has a background in public health and took this seriously from the beginning and set in place contact tracing and testing. So what Vietnam did was start early. They've had these public information campaigns, so catchy advertisements that was successful, that was shared a lot on social media, and just emphasizing the basics: hand hygiene, maintaining distance, avoiding crowds, things like that. They also have a contact tracing app as well. So they've done. There's been no magic bullet. They haven't done anything incredibly innovative or novel. It's just following essentially what I guess now is becoming clear, the public health blueprint in terms of how to deal with any pandemic. They've just done it early, and they've just done it in a coordinated and aggressive fashion.
Cool. I'll ask a question now from Kevin Mao. So he's asked, so he said, sorry I joined late. I'm not sure if you went through this, but my question is that Are there any expected positive economic incomes that result from this pandemic? And how can we utilize our lesson from COVID-19 in the future?
So the first part was, is there any positive income?
Yeah, is there any positive economic incomes? I guess any positive economic effects that results from COVID-19?
And the second part, sorry, I didn't catch that.
How can we utilize the lessons that we're learning right now from COVID-19 in the future?
So let me start with the first one. I don't think as a world we'll be better off economically, but there's a sense in which there can be some segments of the developing world that might gain if countries are looking to diversify their supply chain. So one of the things that have come up in sort of the supply chain context is, for many products and many companies, they're highly reliant on China. And China for the last 20 years has been the factory of the world, where because of high productivity, high scale, firms have found it lucrative to locate their supply chains there. And I think what we're going to see increasingly going forward is countries trying to diversify away, maybe move some production to Vietnam, some to India, etc. So in that narrow sense, I think some developing countries can gain some positive income. But overall, as a globe, I highly doubt that the net effect is going to be positive. In terms of what we can learn, it depends on, I suppose, I mean, I'll respond to that in a sort of more from an economic perspective. And I think thinking about, what sort of, how should supply chains be organized? We need to what extent should we encourage firms to diversify supply chains? I think that's something that's going to be important going forward. And I think, to get a better sense of how we should change, I think it's probably a bit premature. We're still trying to battle the virus in large parts of the world. And I think we don't yet have a clear sense of how we're going to do things differently. A lot depends on how long this lasts. If this is a few months, maybe I'm being a bit cynical here, but if this lasts a few months, then we might see things going back to basically the way they were at some point in 2021. But if this lasts for a while, you might see some fundamental changes in how supply chains are organized, how much trade countries do, etc.
Cool. Sweet. So I have another question from Vivian Wu. So a lot of media has said that there will be a shift in different industries globally after the pandemic, such as shift of manufacturing industry from China to the Southeast Asian countries. Would like to know, what is your opinion on this? Do you think there will be more opportunities emerge for developing countries after this pandemic?
Yeah, I think there are certainly going to be opportunities, but the question is whether other countries are going to be able to take advantage of these opportunities. So in India, for instance, there's a debate now about, well, if countries are looking to diversify out of China, let's use this and try to build our manufacturing exports. But the bottleneck in India is their infrastructure going to be good enough to be able to really handle the diversion of trade? Because let's not forget, the volume of trade China does in manufacturing is incredible. There's no way that another country is going to be able to take a substantial chunk of that away without significant improvements to infrastructure and all these other things. So there's going to be some reallocation, but to what extent that happens depends a lot on how countries like India and Vietnam, etc., respond. And are they able to invest in infrastructure, improve roads, things like ports, things like that? Because that's something that China does really well, and it's often not appreciated when we talk about why China is such a big player in global supply chains.
Awesome. Hope that answered your questions, guys. I have a question of my own. So I guess you talked about diversifying the supply chain,
Yeah.
and that could look like, a lot of countries, I guess, how China does a lot of the manufacturing export at the moment, but with this whole situation, that's all changing. Supply chains are basically shutting off. I guess talking about that then, if let's say they diversify supply chains, will that also increase the risk of, I mean, other pandemics in the future? If you understand what I mean, or if I understand correctly. But like, if they diversify, then I guess there are more networks going on, and then that could possibly lead to that wouldn't really mitigate future pandemics from occurring, if that makes sense.
Yeah, I mean, okay, so let's suppose I get all my inputs from China, and next year I get half of them from China, half of them from Vietnam.
Yeah.
So like, if all future shocks are in China, then this diversification was a good idea. But if there's more shocks in Vietnam than China, then this diversification wasn't that great.
Yeah.
So a lot depends on, where do you expect the threats to the supply chain to be going forward? And I don't think anyone knows the answer to that question. So if there's all these kinds of uncertainties and you have no idea where it's going to come from, the prudent thing to do is try to have source inputs from as many countries as possible. So if you're sourcing from 5 countries, and if one country suffers some sort of shock, then you have 4 other sources where you're getting it from. So again, the only case where diversification might be harmful is if you're diversifying to a country which turns out to be even more shock prone than your original. But that seems, and it's hard to say for sure whether that's correct or not, but I would say that's unlikely.
Okay, awesome. Thanks for that. Does anyone else have any questions that they want to ask? No? Cool.
I have a question. So you were talking about reasons for and against lockdown. So what have these countries actually implemented? Have they went with a lockdown, or did they decide not to go for it? Or
no, I think most countries have implemented some variation of a lockdown. They've varied in strictness. So for instance, India was particularly draconian. They just announced one day that all inter-district travel will be shut down. So people were stuck where they were. They couldn't even go back to their village. In neighboring Bangladesh, there's been sort of a lockdown. It's been called a holiday. It's not called a lockdown. It's called a national holiday. People are encouraged to just go home and work from there, or just take time off. So it wasn't quite as strict as India, but still there's some sense of social distancing going on. So I think my sense is most countries have implemented some form of social distancing. What's varied is the severity with which they've implemented and how strictly they've enforced it.
yeah, thank you.
Cool. I guess just to build off the first question, which was, what can we actually do to help countries? So, I guess every country is sort of locked off in their own sort of bubble right now. And so the only thing we can really do is probably share ventilators, but that's not up to us. So I guess for the general audience though, is the only thing we can do really send money to these countries, so in terms of like remittance, and like just sending them money for them to maybe like buy more food? Is that the only thing that we can do to help, or is there another way as well?
Yeah, there's a sense of helplessness, right? Because it's hard, not easy. So I can send money to people via family networks in Bangladesh, right?
Yeah.
If I wanted to send money to Cambodia, I wouldn't know where to begin, right? Yeah. Who do I send money to? Which organization is credible? Who's going to actually spend that money for the purpose it was intended, etc. So that limits, which is not to say that there aren't NGOs out there that are doing this work. So there are many NGOs where we can donate. And I think given travel restrictions, these types of donations to credible, reputed NGOs and nonprofits is probably the most concrete way we can help. But yeah, the options are limited because of all the travel restrictions.
Okay. Do you have maybe a list of NGOs that we could, I guess, support in order to help developing countries, or?
Oh, Um, Again, not global in scale in the sense that I have no idea
Yeah.
which Cambodian NGO you should. So I don't want to seem like I'm endorsing one over the other.
Okay,
But,
that's fair.
I would rather not go into. I don't know. I mean, I would have to. I can name a few in Bangladesh, but because again, that's where I'm from. But that would be very country specific.
Okay.
Yeah.
Cool.
There's a new question on chat.
You can see that question. Could you?
Yeah.
Maybe? I can't really see that one.
So the question is, have developing countries, so it's from Noreen Ma. It says, have developing countries implemented anything similar to something like Job Seeker, Job Keeper? Or is there something like this that would be feasible? So in most developing countries, it's not feasible for two reasons. One is the lack of sort of fiscal resources to begin with. And two is an administrative barrier. A lot of people don't have bank accounts, don't work for formal firms, so you can't really go through formal channels to distribute money in that way. And I think what most countries have done is relied on non-cash transfers, particularly providing free or highly subsidized food and other essentials as a form of relief. So again, using Bangladesh as an example, our garments industry has been absolutely devastated because Western retailers have canceled orders or asked for 30% discounts, things like that. And so what's happened is the government's provided subsidized food, basic staples essentially, in areas where garments workers live. So that, that's as sort of targeted as you can get, which is sort of go to the areas where garments workers live. You know that their incomes have been cut, and so provide subsidized food and other essentials. And I think given the administrative and financial challenges, that's probably the most feasible way in which governments can provide economic relief to affected workers.
Awesome.
I had one question, if that's all right.
Sure, yeah.
So in regards to more rural communities where maybe they don't have as much information available to them through like various communication channels, I was just wondering, how are these countries getting, or rather, how are these communities getting accurate information?
Yeah, I mean, and that's an incredible challenge. I think in most developing countries, though, there is an established structure for providing aid and other types of economic relief. I think to successfully pass on information, you'd have to leverage those existing links. And I think the way it typically works is through community leaders. So in any village, you would typically have some members of the village, whether it's an officially appointed village elder or leader or something of that, or an equivalent person, which is sort of the conduit if you're trying to pass information through. The challenge with all of this is, of course, that whatever you do, you have to do it quickly. And so taking the time to design the perfect information transmission mechanism is not feasible, because by the time you figure it out, it's late. So in the short run, given all these time constraints, using established village leaders, community leaders is the most practical way of passing along credible information.
And I'd assume that there'd be multiple cultural barriers that prevent this from happening as well. Is that right?
Yeah, no, that's true. And again, you sort of, it depends on the societies in question, but you'd worry about whether that information is being passed on to women to the same extent as being passed on to men. In a lot of aid programs, women are targeted because they've historically been much more responsible with financial and other aid provided by local and national governments. And so you want to make sure in any kind of information campaign, you want to make sure that enough women are being provided information.
Cool, thanks.
Perfect. So if anyone has any more questions, please feel free to just type them down in the chat. Otherwise, if no one has any more questions, I guess Thank you so much, Dr. Reshad, for your time today. The presentation was super insightful. And yeah, thank you guys all for tuning in as well to MUHI's public online lecture series. And yeah, again, thank you, Dr. Reshad, for your time.
No, thank you for having me.